Hello, Don here. Welcome to Podiatry Practice Mastery. We're going to go over Chapter 3 now. This is the $1 Million Practice Formula. So we're going to talk now about the most valuable patient. Earlier in my career, I believed something that most podiatrists believe. Every patient visit had roughly the same value. A visit was a visit, a patient was a patient, but one afternoon something happened that completely changed how I saw my practice. The moment I noticed the pattern. So 2 patients came in that day with very different problems. The first patient was a diabetic foot check. Nice patient, quick visit, everything looked stable. Total visit value for a level 3 established patient was probably around $95 to $100. 10 minutes later, another patient came in with plantar fasciitis. That visit included an evaluation, x-ray imaging, a shockwave treatment plan, orthotics, and the total case was about $1,850. Both patients were equally important medically, but from a practice design perspective, the difference was enormous. One visit produced $100, and the other produced almost 20 times more the value, about $2,000. That was the day I started thinking differently. The most valuable patient concept. In every podiatry practice, certain diagnoses create the greatest opportunity for both patient outcomes and practice growth. I call these patients the MVPs, or the most valuable patients. These patients typically present with chronic conditions such as plantar fasciitis, Achilles tendonitis, toenail fungus, warts, Morton's seroma, metatarsalgia, something that we see all the time. And these diagnoses often benefit from comprehensive treatment plans rather than single visits. And when treated properly, they improve dramatically. And when the treatment plan is explained clearly, patients are usually very willing to follow it. I'm going to go over something I call the patient value pyramid. So if you can imagine a pyramid on the top being a small portion, and on the top it's going to say comprehensive treatment plans, underneath it's going to be procedures, and then the basic visits are on the bottom. So the comprehensive treatment plans are usually things that patients are going to pay about $1,000 to $3,000, and this is going to be either out of pocket or partially covered by insurance. Procedures are usually $300 to $900, and then basic visits are $100 to $200. Okay, so at the bottom, once again, are the basic visits, and these I would include as routine visits, simple follow-ups, ingrown and matrix follow-ups. The typical value is $100 to $200, a level 3 established patients. In the middle are the procedures. These are injections, biopsies, minor procedures like exostectomies or flexor tenotomies, imaging, or small surgeries that are either done in the office or done efficiently in the surgical center, and these are usually $300 to $900. And on the top are the comprehensive treatment plans. And so I would equate these to packages of laser for laser nail fungus, packages of Swift, like 4 Swift packages for warts, amniotic stem cell injections, orthotics or second pair of orthotics, shockwave packages, and these typically are $1,000 to $3,000. Most podiatrists build their day around the bottom of the pyramid. These are these quick little follow-ups or these routine patients that are coming in. But the $1 Million podiatrists focus on identifying the opportunities at the top, and they're always trying to push things up into the top of this pyramid. That is leaving space, leaving room in the day for these types of patients, these patients with plantar fasciitis, Achilles tendonitis, or even when you're offering the top of the pyramid options. You're offering the best options to these patients, and whereas the people that are doing things on the bottom, they're just getting by with just a lot of office visits, a lot of patient visits. Now, I want to be clear. There's one important clarification. This isn't about pushing unnecessary treatments. In fact, the opposite is true. When I look back on my early years in practice, I realized that many patients were undertreated, and they left with minimal instructions and when they actually needed a structured treatment plan. Recognizing the most valuable patient conditions helps you deliver the right level of care. Now, there is a daily habit that changed my practice. Once I understood the concept of the most valuable patient, I started a simple habit. At the end of the day, I document what are my most valuable patients of the day. And I think this does a couple of things. This keeps it top of mind to me, and it helps me write it down on a piece of paper, and helps me to like is kind of referring to the light. So I can see, well, how can I make this patient, or how did I make this patient most valuable patient. Let me give you a couple of examples. One would be, as I mentioned before, Achilles tendonitis patient that's going to be getting shockwave. If they have a bulbous tear, they're going to get an amnio injection. They're going to get orthotics, maybe a second pair of orthotics. So that's going to be about $2,000 to $2,500 in value. This habit it created something interesting. It trained my brain to recognize good treatment opportunities and have the boldness to offer the treatments to patients. And over time, those opportunities became easier to see. So there's something called the most valuable patient question. When a patient presents with a condition like plantar fasciitis, I now ask myself a simple question. What's the best treatment plan for this patient, disregarding the amount that the treatment costs? Like, what's the best treatment for them? Not the fastest, not the cheapest, but what's the best? Because when you focus on delivering the best plan, revenue usually follows naturally. And here's a simple script I use after doing the exam. I do a gait evaluation, look at the x-rays. I say, Mrs. Jones, there are good, better, and best treatments. I'm going to start with what I feel is the best treatment for you based on everything we went over today. And then if they want to go and do less of that, they can choose that. So my simple rule is when I'm recording things in my office, it's the MVP rule, the most valuable patient rule. So 2 MVP patients per day make $1 million practice. It's real simple. So 2 MVP patients a day make $1 million practice. So the action steps: identify the top 5 most valuable patient diagnoses in your practice, and track your most valuable patients of the day, and review how these patients are treated in your office. You may discover an enormous opportunity hiding in plain sight. Most doctors immediately recognize the MVP patients in their schedule once they understand this concept, but recognizing them and consistently structuring plans around them are 2 different things. Most doctors understand the idea after reading it, but very few implement it consistently without systems in place. Now that's exactly why I help doctors inside the $1 Million Club. So this is something that I put together. It's a small group coaching for doctors that want to help implement these systems. And so if you're interested in this, you can go to Podiatry Practice Mastery and shoot me an email, actually. You can go to podiatrypracticemastery.com/coaching, and that's where I talk about the $1 Million Club, where you can try to apply to be part of that. So next, we're going to examine a factor that determines whether patients actually accept treatment, the structure of the patient visit. So I hope you enjoyed this one. This is one of my biggest takeaways about MVP patients. And the reason the 2 MVP patients, I'll show you later on, but if you're like seeing 20 patients a day and 2 of them are MVP, let's say the average MVP value is like $1,000 each. So 20 patients at, let's say, $100 a piece is $2,000. And then if you have 2 more at $1,000 each, that's going to give you to the 4,000 mark, which is what you need to produce, okay, per day. So you need to get to the $4,000 per day. So it's a full patient schedule with 2 MVPs. Now maybe 1 MVP was an orthotic, which is $600, but usually if you're going to do a shockwave package, it's probably going to be $1,500 to $2,000. So that's how you're going to get to the 2,000 mark on additional these MVP patients. So I try to keep that focus of $2,000 in MVP and then another full schedule. Now you can't do this if you don't have a full schedule. So if you're not seeing like 20 or more patients, it's going to be hard for you to do this on a very limited amount unless you're purely a cash pay office. Okay. So next we're going to go over the next framework. If you want the whole book download, you can go to podiatrypracticemastery.com/book or /coaching if you want to learn more about this $1 Million Club that I put together, that we're going to work together to help you implement the things we're talking about in this book.